Hello, everyone, and welcome to today's webinar entitled Healthy Children, Healthy Weight. On behalf of the Academy of Nutrition and Dietetics, CDPHP, and the Alliance for a Healthier Generation, I'd like to say thank you for attending the webinar, and a special thanks to CDPHP for asking us to present this topic to all of you. And we truly hope that you find the information that we're about to present helpful both for you and your family. So before we get started, I'd like to begin with just a few introductions. My name is Karen Ferrantella, and I am a registered dietitian employed as the Manager of Advocacy and Communications for the Nutrition Services Coverage Department at the Academy of Nutrition and Dietetics.
And hello, everyone. My name is Liz Martin, and I'm the Director of Population Health and Wellness for Capital District Physicians Health Plan, or CDPHP. Ensuring that your family eats healthy foods and gets the recommended amount of physical activity isn't always easy. CDPHP is here to help you and your family. We can guide you through a health issue, answer questions, and inform you of helpful services in your community. We want to help you achieve your healthiest level, whatever that may be. More information is always available at www.cdphp.com or by calling the member services number on your ID card.
I'd like to give you just a little bit more information regarding the Academy of Nutrition and Dietetics, who some of you might remember is the American Dietetic Association. The Academy is headquartered in Chicago, Illinois, and it's the world's largest organization of food and nutrition professionals. And to date, we have approximately about 74,000 members, and 72% of those are dietitians, registered dietitians. Our members represent a very diverse and a really wide range of practice areas and interests, but they really all share the common goal of providing reliable, credible, and evidence-based nutrition information to the public. Now, the Kids Eat Right initiative, which is a joint effort of the Academy and the Academy's foundation, encourages the involvement of both Academy members and consumers, where the members can opt to become Eat Right campaign members and take part in various actions to help educate families, communities, and policymakers about the importance of quality nutrition for children. And this campaign has been very dedicated to supporting the efforts of the White House to end the childhood obesity epidemic within our generation. And the Academy continues to be energized by the momentum that's been created by our First Lady, Michelle Obama, in her Let's Move campaign. Today, we talk about children and healthy weights, and it's important for you to remember that overall health and weight are all connected. It's really vitally important at a young age to promote a healthy weight and growth in all children. A family environment truly plays an important role in this. Promoting a healthy lifestyle and a healthy weight can help a child feel better just in general. It can give them more energy. It can even help improve their self-esteem. And we as caregivers or parents, we all play a role in helping children develop healthy habits. Now, I know many of you are already doing things to promote a healthy weight for your children, and you should be really proud of doing so, because you are setting an important foundation that will benefit your child or children for the rest of their lives, and you are leading by example, more importantly. So what exactly do you do to help your child maintain a healthy weight? Well, the first step you can do is to really be a very positive role model, and you can demonstrate to them that you're eating healthy and also staying active. You can also set the tone at meal times by providing a nice, calm environment in a reassuring climate at the dinner table, during dinner, and also during their snacking. Another way, and a really important way, is by limiting TV, computer time, and video games in your household, so it's not excessive and they're not spending too much time being sedentary. Even freeing up that time might provide the opportunity for the entire family to participate in possibly some enjoyable physical activities for routine exercise. As you and your family make positive steps towards maintaining a healthy weight, it's really important to remember your child's self-esteem and the importance of them maintaining a positive body image. If your child is overweight, restrictive diets and excessive exercise regimens should be avoided, and healthier approaches should take place to try and help them lose weight. So as we discuss healthy children and the importance of maintaining a healthy weight, we also have to acknowledge that unfortunately, childhood obesity is very much present in the United States, and there are a lot of factors that contribute to this, and a shift in lifestyles is certainly one of them. Today, a lot of children experience a very different lifestyle when compared to 30 plus years ago, when most people led lives that kept them at a healthy weight. And you're probably wondering, well, why is this? Well, some of the reasons might be that 30 years or longer ago, children walked to and from to school every day. They ran around recess and in gym class, and they played outside for hours on end until it was dinner time. Now, today we know that a lot of children walking to and from school has been replaced by car and bus rides. And in fact, gym, recess, and other school sports programs have also been cut from some community and school programs, and the kids are spending a lot more time in the afternoons with the television, the internet, or playing video games. With all the advancements that they have in technology, it's made it very enticing for children to want to spend more time doing this. You know, busy lives and families can also play a role. Home-cooked meals and reasonable portion sizes can at times be replaced with increased snacking and increased intake of sweetened beverages, convenience, and even fast foods. And of course, we can't forget that there is a nationwide epidemic of exploding portion sizes that seem to dominate most restaurants and a lot of the fast food chains. So you hear the word obesity, and what does that mean to you? Well, a simple definition is basically having an excess amount of body fat. And being obese can have a significant impact on a child's health and their well-being. You might be wondering, why are we focusing on healthy weight for children? Well, the reality is that children and adolescents who are or become overweight or obese are at risk for many health problems requiring attention by a physician. And a lot of these health issues previously weren't even seen until adulthood. Some of these conditions have more serious health risks requiring ongoing medical management and treatment. And some of those risks that are associated with being overweight or obesity can include things like type 2 diabetes, high blood pressure or hypertension, high cholesterol, heart disease, asthma, sleep apnea, skin infections can develop. Children can have complaints of joint pain. And on the other flip side of things, they can also experience low self-esteem and self-confidence, which can also be linked to poor academic performance. This can lead to fewer friends and even depression, and all of these things can persist into their adult years. So when do you need to start to worry about your child's weight? Well, for a child to be considered overweight or obese after the age of 2, their BMI or body mass index must be assessed. And when assessing the BMI, the child's height and weight will typically be plotted on the Center for Disease Control, BMI for age growth charts, both for girls and boys. And this will provide a percentile ranking. Now, you've likely already experienced this with your child's health care provider during a well visit. Percentiles are what is commonly used as an indicator to assess the size and growth patterns of children in the U.S., and they show the relative position of a child's BMI number compared to children of the same sex and age. A child is considered overweight when the BMI is over the 85th but less than the 95th percentile, and a child is considered obese when the BMI is greater than the 95th percentile. Now, to better understand how much of an epidemic childhood obesity is, it's really important to look at some recent trends in statistics. The incidence of obesity among children in the U.S. is staggering, and childhood obesity is now the #1 health concern among parents in the U.S., topping drug abuse and smoking. Almost 1 in 3 American children and teens are overweight or obese, and only 1 out of 25 children are not obese or overweight, are more active, eat healthier, and are less likely to develop type 2 diabetes. Now, it's been suggested that if we don't reverse this epidemic, the current generation of young people could be the first in U.S. history to live sicker lives and to die younger than their parents' generation. According to the most recent National Health and Nutrition Examination Survey, childhood obesity has more than tripled in the past 30 years, which, as we mentioned on a previous slide, has caused a broad range of health problems that the medical community would normally only see in adulthood. Now, just to give you an idea from a numbers perspective, 12 million children ages 2 to 19 are obese and 23 million are overweight or obese. The graph you see on the slide is a graph from the National Health and Nutrition Examination Survey, and it further illustrates how the obesity trend among U.S. children ages 6 to 11 and 12 to 19 has steadily continued to rise over the past 37 years, from 1971 to 2008, from about 4% to 17.4% for the ages of 6 to 11, and from 6.1% to 17% for ages 12 to 19. The likelihood of childhood obesity can be attributed to many key factors, and some of these factors being environmental and economic, and researchers have noted that significant variations now occur from state to state for both obese and overweight children. The map you see on their screen displays that the dietary and physical activities and behaviors of children and adolescents are influenced by many sectors of society, and this includes families, communities, schools, child care settings, medical care providers, even faith-based organizations, government agencies, and the media can all make a difference in the course that the food, beverage, and the entertainment industries have an influence on with obesity. This 2011-2012 map from the Childhood and Adolescent Health Management Initiative Survey illustrates the percent of children whose weight status is at or above the 85th percentile for BMI. And across the U.S., 31.3% of children met this indicator. And as we look at the map, the states that you see that have the darkest blue color, meaning Washington, Oregon, Wyoming, Utah, Colorado, South Dakota, Pennsylvania, Vermont, New Hampshire, and New Jersey, they were all significantly lower, which is more desirable, than the U.S. indicator. And in the state of New York, it was noted that it was higher than the U.S. indicator, but it was not significant. And lastly, the states you see in white, some of which are Arizona, Texas, Louisiana, Mississippi, and South Carolina, they are significantly higher, which is less desirable than the U.S. indicator. Now, in the midst of all this data, there is a little glimmer of hope. The Centers for Disease Control and Prevention recently reported that obesity rates among low-income preschoolers ages 2 to 4 are actually falling in many states for the first time in decades. In fact, in 18 states, data collected revealed that there was a slight drop in obesity, which might be a positive sign that many of the different efforts that are underway to increase the awareness of healthy eating and an active lifestyle might be in fact working.
I think we all realize that an overweight or obese child may be at risk for some serious health problems. With that in mind, CDPHP encourages you to take full advantage of the Healthier Generation benefit. This benefit can support a healthy lifestyle for your children and increase awareness of the health benefits of being at a healthy weight. CDPHP has collaborated with the Alliance for a Healthier Generation to offer children the opportunity to work with their primary care provider in partnership with a registered dietitian to achieve long-term health. The Alliance for a Healthier Generation was founded by the American Heart Association and the Clinton Foundation, and the Healthier Generation strives to reduce the prevalence of childhood obesity and empower kids to develop lifelong health habits. You and your family can truly benefit from scheduling visits with a registered dietitian in partnership with your primary care provider to take advantage of the Healthier Generation benefit. However, some of you may not even be aware of what a registered dietitian is or what they can do for you. So for that reason, we would like to share with you the following video that has been produced by the Academy of Nutrition and Dietetics. This video will give a great overview of just exactly what a registered dietitian can do for you.
Between what you hear on TV and read in the news, eating right can seem like a real challenge. Diet books and the internet may seem like easy solutions, but your best bet is the personalized services of a registered dietitian. Whether you want to slim down, lower your cholesterol, or simply eat better, a registered dietitian can help cut through the clutter of confusing nutrition advice and provide a sound, easy-to-follow plan that is tailored to you and your goals. Anyone can call him or herself a nutritionist, but only a registered dietitian has met the comprehensive standards established by the Academy of Nutrition and Dietetics. In addition to earning a bachelor's degree, an RD must complete a specially designed nutrition curriculum, pass a rigorous national registration exam, and complete an extensive supervised training program. Roughly half of all RDs hold graduate degrees, and many have advanced certifications in specialized fields, such as pediatric, renal, oncology, or sports nutrition. A registered dietitian is your trusted source for credible food and nutrition information. An RD will help you develop a plan to improve your health that is realistic for your lifestyle and tailored for your individualized needs. An RD will help you find the best path from where you are now to where you want to be. In addition to your family and medical history, questions might include, do you eat together as a family or with others? Where do you grocery shop? Do you like to eat out? What do you do to exercise or stay healthy? Planning meals, touring the grocery store, reading labels, and tracking your progress are all activities that you and your RD might do together.
If you could walk me through a typical day of what you normally eat.
An RD will help you understand how good nutrition benefits other areas of your health and life. Changing habits is not easy, and it doesn't happen overnight. But meeting with your RD on a regular basis can help you talk through challenges and together discover successful solutions. Typically, visits occur about every 2 weeks for 2 to 3 months, then monthly for another 3 or 4 months in order to track your progress. If you have high cholesterol, high blood pressure, diabetes, kidney disease, or cancer, it can be especially hard to know what to eat. An RD can help you understand your lab results and how nutrition can affect your condition and health.
Your blood sugar started to rise.
Then he or she will help you create a personalized eating plan that includes all the important nutrients that can help you manage your condition and fit into your lifestyle. When you have a condition like celiac disease, food allergies, or lactose intolerance, it's easy to be overwhelmed by what you can't eat. An RD can teach you how to read food labels, identify which ingredients to avoid, and also help you find delicious substitutions to keep your diet balanced and tasty too. Many private insurers and state Medicaid plans, as well as Medicare, cover visits to registered dietitians for certain preventive services and health conditions, usually with a doctor's referral. Check with your healthcare provider to see if visits with an RD are included in your insurance plan. To find an RD near you, visit eatright.org. You can also check with your local hospital, your doctor, or your insurance company. Start your wellness journey with the personalized nutrition advice of a registered dietitian, your trusted nutrition expert.
If you would like to watch the video again or to share it with others, you can use either the first link on the screen, which will take you directly to the CDPHP website, or use the second link, which is from the Academy of Nutrition and Dietetics.
So hopefully now, after viewing the video, you have a greater understanding of why it is so important for you to schedule visits with a registered dietitian as well with your provider as a part of the Healthier Generation benefit. This benefit offers comprehensive health benefits to children ages 3 to 18 and their families for the assessment, prevention, and treatment of childhood obesity. The benefit provides 4 visits with a primary care provider and 4 visits with a registered dietitian for nutritional counseling. These services are subject to and applicable deductibles, co-payments, co-insurances, and group-specific contract limitations if there are any. If you are concerned about your child's weight, call his or her PCP today to help guide your child towards a healthier future. Take this opportunity to discuss the benefits of meeting with a registered dietitian and how the collaboration can support your efforts to help your child maintain a healthy weight. So when you're at your child's doctor, it's very important to take a proactive stance with your child's health. Take advantage of these appointments and ask some key questions. For example, how is my child's weight? Your child may need to lose weight, gain weight, or be encouraged to maintain his or her current weight in relation to their age and height. What is my child's BMI? Make sure your healthcare provider is tracking your child's BMI to determine his or her BMI percentile. Make sure you also talk to your child's doctor about the following. Number 1, your family's and child's eating habits. Let your provider help you determine what your child's and family's diet should look like and if you should be eating more or less or different types of foods. Number 2, your child's physical activity levels. Ask your provider what type of intensity of activities are best for your child. And number 3, let your provider know what an average day looks like for you and your child. These items will help your provider determine if there are specific areas your family can improve to live healthier. Work with your provider to develop a plan to address these elements to get your child to a healthy weight or to keep them at their healthy weight. If you have questions about the Healthier Generation benefit or how to find a registered dietitian, contact the member services number listed on your ID card or visit www.cdphp.com/healthykids to learn more about the Healthier Generation benefit and to look at other tools to help your family live a healthier lifestyle. Some of these tools include the tip sheets and resources listed on this slide.
As this presentation comes to a close, we would like you to remember the following. CDPHP is here to help you understand the benefits of living a healthy lifestyle and guide you along this path. The Healthier Generation benefit supports the services of both a provider and the registered dietitian. And lastly, the expertise and personal guidance of a registered dietitian, together with your primary care physician, will provide you with the greatest level of support in your journey towards a healthier lifestyle for your family.
CDPHP, the Alliance for Healthier Generation, and the Academy of Nutrition and Dietetics would once again like to thank you for taking the time to view this webinar. It has been our pleasure to present this to you today, and we certainly hope you have found it to be helpful.